Have you ever wondered what ADHD really is? Well, let's set the record straight. ADHD, or attention deficit/hyperactivity disorder, is a common neurodevelopmental disorder. It's not just a term thrown around when someone seems a little extra energetic or has difficulty focusing. It's a real, medically recognized condition that affects both children and adults worldwide. So if you've been curious or perhaps even confused about ADHD, you're in the right place. Let's delve deeper to understand what ADHD actually means. ADHD, contrary to popular belief, isn't simply about hyperactivity or lack of attention. This disorder is much more complex, encompassing a range of behaviors and symptoms that vary greatly from person to person. Indeed, ADHD is typically classified into three types: predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation. Let's start with the predominantly inattentive presentation. This type of ADHD is characterized by difficulty paying attention and staying on task. Individuals with this form may appear to be daydreaming or in their own world. They may miss details, forget things, and frequently switch from one activity to another. It's not that they're not interested, it's that their brains are struggling to keep up with the information flow. Next is the predominantly hyperactive impulsive presentation. This is the type that most people envision when they hear ADHD. Individuals with this form are often restless, impulsive, and have a hard time sitting still. They may talk a lot, interrupt others, and struggle with self-control. This can make social situations challenging and lead to difficulties at school or work. Finally, there's the combined presentation, which, as the name suggests, combines symptoms of both inattention and hyperactivity impulsivity. This is the most common type of ADHD. Individuals with the combined presentation may have trouble following instructions, staying organized, and controlling their impulses. They may be constantly on the move and struggle to complete tasks. But remember, ADHD is not a cookie-cutter condition. Each individual's experience with this disorder is unique. Some people may struggle more with inattention, while others may have more difficulty with hyperactivity or impulsivity. And some may experience all of these symptoms to varying degrees. ADHD is a spectrum, with each individual falling somewhere along that spectrum. So, you see, ADHD isn't a one-size-fits-all condition. It presents differently in different individuals. But how do we recognize ADHD? What are the signs to look out for? Well, ADHD manifests in a variety of ways, and the symptoms can vary greatly from person to person. However, there are some common signs that might indicate the presence of this condition. Let's delve into them. One of the most common symptoms of ADHD is difficulty focusing. This might be perceived as a lack of attention or easily getting distracted. For instance, an individual might have trouble concentrating on a single task for an extended period of time or frequently lose their train of thought. Next is hyperactivity. This could manifest as constant movement, restlessness, or talking excessively. It's not just about being energetic, it's a persistent pattern of activity that's more than what's considered normal for a person's age. Impulsivity is another key sign. This might show up as impatience, making hasty decisions without considering the consequences, or having difficulty waiting their turn. Forgetfulness and disorganization are also common symptoms. This can include frequently misplacing items, forgetting appointments, or having trouble organizing tasks and activities. It's important to remember that these symptoms can vary in intensity and frequency between individuals. Some might experience them more severely than others, and some might struggle more with certain symptoms over others. Remember, these symptoms might also be associated with other conditions, so it's important to seek professional advice for an accurate diagnosis. So, what causes ADHD and how is it treated? Well, the exact cause of ADHD remains a mystery. However, experts believe it's a concoction of several factors, each playing a significant role. The first of these is genetics. Yes, ADHD can run in families, suggesting a genetic predisposition. Next, we have environmental factors. Certain circumstances during pregnancy, such as smoking, alcohol use, or exposure to environmental toxins, can potentially influence the development of ADHD. And lastly, we have neurological aspects where differences in certain parts of the brain may contribute to ADHD symptoms. Now let's turn our attention to treatment options. It's important to remember that while ADHD can't be cured, it can be managed effectively with the right treatment plan, and individuals with ADHD can lead successful and fulfilling lives. Medication is often a key part of this plan. Stimulant and non-stimulant medications can help balance brain chemicals and improve focus, attention, and impulsivity. It's not a one-size-fits-all solution, though, and it's crucial to work with a healthcare provider to find the right medication and dosage. Behavioral therapy is another effective treatment approach, especially when combined with medication. This type of therapy helps individuals learn to manage their behavior, improve organizational skills, and cope with everyday challenges. It's not just for the individual with ADHD either. Often, family members and teachers are involved to provide support and reinforcement. And finally, lifestyle changes can also make a significant difference. Regular physical activity, a healthy diet, sufficient sleep, and a consistent routine can enhance overall health and well-being, which in turn can help manage ADHD symptoms. So there you have it. ADHD may be complex, but understanding its causes and the variety of treatment options available can pave the way for a more informed, compassionate approach to managing this condition. While ADHD can't be cured, with the right treatment plan, individuals with ADHD can lead successful and fulfilling lives. So, to recap what we've learned today about ADHD, we've delved into the 3 types of this disorder: predominantly inattentive, predominantly hyperactive impulsive, and combined presentation. Each type has its unique set of symptoms, but common among them are difficulty focusing, impulsivity, and hyperactivity. We've also explored some of the possible causes of ADHD, including genetic factors, brain injury, and environmental influences during pregnancy. It's important to remember that it's usually a combination of factors and not a single cause that leads to the development of ADHD. As for treatment options, we've discussed various approaches from medication and therapy to lifestyle changes and skills training. A combination of these often proves most effective. Understanding ADHD is the first step towards supporting those who live with it every day. Remember, every individual's experience with ADHD is unique, and that's okay. Subscribe and don't forget to take care of yourselves. Bye!